So just a final check, Olivia, you should see Patrick spotlighted on your screen.
I see Patrick on the right-hand side, yes, in the small box.
Fantastic. Okay, Irene, over to you for countdown and launch.
Yep. We have 14 people in the waiting room at the moment, so I would suggest let's wait until 4:15. It's been a long APFSD day. I'm sure participants will slowly start streaming in right around after start time. So then, is that okay with you?
Yes, no worries.
Noted. So if you have a glass of water in front of you, now might be a good time to take a few sips before we talk for an hour and a half. Oh, Patrick is ready to go.
Irene, I'll pick up on admitting after you start.
Thanks. It's 4:15 in Bangkok, so let's go ahead and get started. I'll do a countdown now, 5, 4, 3, 2, 1, to let you know that participants are coming in. Letting participants in 5, 4, 3, 2, 1.
Good afternoon, everyone. My name is Patrick O'Farrell, and I'm currently working with the Environment and Development Division of ESCAP, and I'm a member of the team that's been developing this e-learning that we're launching here today. And the focus of this is on, as you see it on screen, integrated action on biodiversity, ecosystems, health, and climate. So you're very welcome to join us. I'm not quite sure how many people we have in the room, but I think it makes sense to go ahead and to kick off this meeting. I will be moderating the event today, but I'll also be the person that's giving you a sneak preview of this online course. At this point, I would ask Irene to please launch the poll, the very first question. And today, what we'd like to do is get an understanding of who exactly is in the room and participating in this call, this Zoom room. So we'd like to launch an online poll. This first question, as you see appearing on your screen, is what sector do you work in? And we'd like to know where people work, just so we have an understanding of who in the audience we're talking to. Do you work for local government? Do you work with international government? Are you a member of a civil society organization? Do you work in the private sector, or you're based at a university or other education institution, or possibly none of those categories suit you, and maybe you need to check the other box. I'm going to give it a little bit longer. I see we've got more and more people entering the room as the votes come in. Okay, I'm going to wait for this poll to get towards 80%, and then we'll quickly review on who we have in the room at the moment. At the moment, it looks as though it's the international governance sector that's winning, along with other organizations, both on 26%. Who's it going to be? Okay, so we've reached that magic 80% marker. Irene, I will ask you to pause that, and we can just quickly reflect on the results. Once again, so as I said, it looks like the international governance sector is the most dominant sector here. We've got national governments and local governments following a short second. And we've also got quite a lot of people from the education sector. Unfortunately, we can't unpack this other sector too much, but maybe some of that will come up in the Q&A. I would like you to please stop sharing these results. And could you go into the second question, please, Irene? Okay, so for those of you who've just joined us, we're just basically doing two brief polls, online polls, to understand who's in the room with us. The second poll is just asks, how familiar are you with this topic that we're dealing with today? So the concepts and issues associated with biodiversity, climate change, and health, this nexus. Your options range from having absolutely no understanding of this issue to a limited amount of understanding, stretching all the way to being an absolute expert in this field, where you're highly familiar with these concepts and issues associated with biodiversity, climate change, and health. Again, I will let this poll to run just beyond 80%, so we can get a feel for most people's level of understanding. Again, it seems like some people, or most of the people that are entering the room, have some understanding of this nexus and these nexus issues, so that's a really useful foundation to work from. It seems as though one or two that not quite sure what we're talking about, and I hope you'll walk away from this discussion knowing a little bit more. Okay, so we've hit that 90% mark now, which is really fantastic. Okay, please will you stop the poll, Irene? Thank you. Okay, so as I said, 60% of the room has a limited understanding of the nexus issues. There are one or two people that are experts in this area. We do hope they stay and contribute to the question and answers. I'm always ready to learn more. You can provide us with some feedback on the course, which would be really, really useful. There are about 5 people that have no knowledge. We hope we can provide some of this for you today. And then there's some people who have a fairly detailed understanding so far. Irene, I would like you to please stop sharing these results. And now I would really like to kick off today's launch. And in doing so, I would like to ask Mr. Olivier Richard, who's the Deputy Head of Mission at the Embassy of France in Thailand. The French Embassy has funded the development of this e-learning, so I would like to welcome him and ask him to please kick us off. Thank you. Irene, we seem to...
Okay, good afternoon to everybody.
Okay, there we go.
Is it fine? Yeah.
Good
afternoon to everybody. I'm quite happy to open this side event today, co-organized with ESCAP. Over the last 2 decades, some experts have been trying to warn us, to alert us to the need to tackle biodiversity losses, threats to animal, human, and ecosystem health, and climate change in a holistic manner, all together, what we call nexus today. But to say the truth, they haven't been heard for quite a long time until the COVID crisis emerged, which finally raised awareness of the importance of their call. That's the reason why I would like to grasp this opportunity today to pay tribute to those experts, because some of them are around the table or behind the screen today with us. Therefore, I think the COVID-19 crisis must be seen as an opportunity to increase our level of ambitions, not only on sustainable development, but also on One Health and planetary health. This is a crucial condition for the social and economic recovery of all communities and sectors. It is our responsibility as representative of government, civil servants, decision makers to reduce the vulnerability of the population, which collectively calls for concrete actions in a context of climate change and environmental degradation. This is what France and Germany are trying to achieve with a new program called PRESOD, which is an international research and development initiative launched last January in Paris during the One Planet Summit. In line with the One Health philosophy, PRESOD aims to prevent the emergence and spread of zoonotic diseases and pandemics, in particular by reducing pressure on biodiversity. There are many French research institutes involved in this program, CNRS, IRD, CIRAD, INRAE. They deal with agriculture, animal and human health, environment, sustainable development, and they will strengthen their cooperation with different parts of the world facing risk of zoonotic emergencies for this purpose. In the same spirit, France is launching a regional project called One Health in Practice in Southeast Asia, which includes all ASEAN countries in order to better inform decision makers on emerging disease and to contribute to build capacity to prevent and respond to future pandemics emergencies. This is also what we aim to achieve when we participate to the last executive training in November 2020, organized by ESCAP. I would like just to stress the fact that France is very interested into Asia and Pacific region, but maybe you may wonder why. First of all, because Asia Pacific is home to a very important and significant biodiversity, and at the same time faces serious economic and health issues, both in rural and urban areas, but also because France sees itself as an Indo-Pacific power. We have a French Indo-Pacific strategy based on multilateralism and cooperation, especially on global issues, because there are French territories in the Indo-Pacific area, like New Caledonia and French Polynesia, both associate members of ESCAP. So I have no doubt that this e-learning session today will be a success. And I would like to thank again the Environment and Development Division of ESCAP and the French expert taking part to this session for this opportunity. Thank you very much.
Patrick, you are currently muted.
My apologies. Thank you. Thank you so much, Mr. Olivier Richard. Really appreciate your welcoming us in this way, and thank you so much. I would now like to, I suppose, give everyone a view of this e-learning. I think this is why people are here. I'm just going to share my screen. Okay. Okay, I hope everyone can see that. This should be the title page that you're seeing. So this, I would just like to put in the proviso that this is a beta version of our course that we're launching here today. There are a couple of issues that we are still clarifying, but it is, in a sense, almost ready to go. We will be providing you with the link to this course that you'll be able to click on and take. As soon as it's ready, we'll be doing an email shot of that. Okay, so the purpose of this e-learning, it is really to share the latest knowledge and approaches and techniques that are around tackling these urgent environmental issues, specifically associated with biodiversity, climate change, and health within this context of COVID. And this course aims to explore, in particular, the interconnectedness of these issues, and really engage in this topic in order to, in a sense, reach this, hopefully we can reach the Sustainable Development Goals by 2030, and most importantly, prevent further zoonoses. So what you've seen is the title screen and the purpose. I'm going to just click on the course introduction, which you'll be able to do yourself, so it'll look very much the same, and I'm going to click on start the course. Okay, so the course outline here provides a list of the 4 objectives that we've tried to meet in providing this course. The first objective is to, as I said, explore the interconnectedness of biodiversity, climate change, and human health, with specific reference to COVID-19 in these different modules. And we really want to generate the awareness and the importance of being stewards of nature, ecosystems, and biodiversity, as well as thinking about climate change and raising ambition, in a sense, to look for regional integration in the way we tackle these issues, particularly in the Asia-Pacific region. The course is intended to try and share best practice in applying a nexus approach to these issues. And it's also to highlight the importance of regional collaboration in meeting these different challenges. Okay, you'll see throughout the course, and I'm going to, the next time I speak to you, I will show you some of the technical issues in terms of moving through it. But just some very brief ones. On the left-hand side of my screen is the course introduction. There are different modules that are listed here, modules 1, 2, 3, and 4. all doing slightly different things, and I'll cover them in a moment. Whenever you get to the end of a section, there's a hit continue button, which I'm doing now, and it provides background to the reasons and the overview for doing the course. We don't have time to, unfortunately, go through the course and all the details, so I'm just going to do quite a bit of jumping around. I hope people are able to keep up and follow. I apologize if you're not. I would just like to pause on this section here for a moment and to highlight the key questions. Really, they cover the essence, in a sense, of what this course is trying to do. And I'm going to read through these different bullets. And the first one talks about how biodiversity, health, and climate change are linked. You know, that really, in essence, is what we're trying to do here. We're trying to understand what are the key environmental issues as well in the Asia Pacific region and how these are interlinked. We explore the effects of what is zoonoses and what are the drivers of zoonoses. What does COVID-19 teach us better about managing our environment? And why is it integrated and holistic management of environment? Why is this important in terms of engaging with these different intersecting issues? That's fundamental to understanding the Nexus approach. What are the approaches that can guide policymakers in trying to resolve some of these issues? And we also think about what are the concrete actions that can be taken by policymakers in the Asia Pacific region. And furthermore, a last point which I made earlier is around regional collaboration and engaging for change. What are our suggestions here? So those are the main. Just moving on. As I said, the course consists of 3 different modules. The first module is about generating a foundational understanding of nexus issues, biodiversity and climate change and health. Here, what we're trying to do is really to build the foundation for the learners or the participants on this course about what are the key biodiversity issues in the region. You know, how is climate change emerging? What are the drivers of climate change, and what are the key factors and impacts that it's going to have, as well as what is the current state of health of these different people and how will that change, are likely to change into the future. So Module 1 is really about building that foundational understanding around these core different concepts. The second module really gets into the meat of dealing with this nexus issue, these interconnections in a sense, and it explores the tensions between biodiversity and health, and climate change and health, and the relationship between changing biodiversity and climate change. And we draw those out too. Within both of these first 2 modules, we pay specific attention to trying to understand the Sustainable Development Goals and what role the Sustainable Development Goals can play both in guiding the way we might move forward, as well as acting as potential tools for monitoring nexus issues. So those are covered in some depth too. The third module really allows us to try and present different tools and approaches for dealing with particular nexus issues. And we present here a variety of different frameworks that learners and participants can work through and get to grips with, and then hopefully apply within their own contexts. After presenting all these different frameworks, our 4th module really is it's a practical module. So the first 3 deal with theory, and the final one deals with implementation. And in this exercise, in this 4th module, we provide an exercise which consists of 3 tasks, and participants here work from a problem to solution, should I say, in finding their way and applying the knowledge that we hopefully have imparted and given them, and the tools and frameworks that they then use and apply to a specific world, or to a specific situation within the Asia Pacific region. Okay, so those are the 4 modules. I'm not going to go into presenting each of the modules here. I think it makes more sense. You can see when you're logged into the course, you can jump around. I'm going to now move quickly on to this section 1.3, which is a definition of what the nexus is. I suspect that people in the audience might be a little confused, and I just want to take this moment to clarify what exactly do we mean by a nexus. So here we define a nexus as the dependencies and interdependencies or connections between one or two or more issues or factors, such as sectors of the economy, and the synergies and conflicts and trade-offs that exist and arise between these as a result of different factors and how they're managed. And you ask, why is this important? Well, it's important because understanding a nexus and exploring a nexus allows us to really understand how these different factors interact and potentially recognize conflicts and potential trade-offs that are being made when we make decisions. Within this context of this course, this is really about understanding the interplay between changing climates, between biodiversity loss, and these different growing environmental crises that are emerging, and what the impact this has on human health, and as we've seen, the emergence of zoonotic diseases. By developing this understanding, we hope that we've been able to better manage this risk and develop informed policies, in a sense, that can direct us and help to mitigate this risk into the future. Okay. As you can see, this course provides a lot of information. We have used a variety of techniques in trying to keep people focused and to make them aware. We use different interviews, we use videos, and one of the things that I'm about to show you is an animation technique. I'm going to play this animation, which tells us exactly what a nexus is, and it speaks to the essence of this course. It's 2 minutes, so please do bear with us, and I hope the sound works.
The biodiversity, climate change, health nexus. In unpacking this nexus, we focus on examining key interactions and connections between biodiversity, climate change, and human health. We use the example of tropical deforestation to highlight these interconnections. An intact, pristine tropical forest has a diversity of plant and animal species, so it can be said to have high levels of biodiversity and good ecological function. Tropical forests also provide multiple different ecosystem services and benefits to people, such as food, water, materials for construction, opportunities for recreation, and important refugee and nesting sites for essential crop pollinators. Tropical forests are and will continue to be impacted by climate change. As climate change intensifies, forest habitats change, and forest species ranges shift and shrink accordingly. The net effect is smaller forest areas and smaller habitats available for tropical forest species. Forests are also lost through clear felling by farmers or agribusinesses to produce livestock or agricultural products such as palm oil. People also move into these cleared areas at this agriculture forest interface or contact zone. This loss of tropical forests and their associated habitats affect multiple different indigenous fauna species, like certain small mammals and insects. Some of these species are, however, able to survive in and utilize these transformed landscapes, bringing them into contact with livestock and people. Individuals of these species may have a disease or may be a vector of disease. This close proximity between forest species and livestock increases opportunities for disease transmission between forest faunal species and livestock, and then onto people. If this occurs, people could become ill with negative social and economic consequences. Under certain conditions, transmissions such as these can turn into pandemics, as has been the case with COVID-19.
Okay. So that gives you an indication of what this nexus is that we're dealing with here today. And as I said, the course is loaded with different videos and different interviews. It also points to a variety of different material for reading. But most importantly, one of the core aspects that we've tried to provide in this course is to allow experts in these different fields to, in a sense, have a voice And we're very lucky today to have two of these experts who've contributed extensively to this course. When you scroll through their different sections, you will see interviews as well as reference to their work and places where you can download PDFs of their different publications. In particular, we have Serge Morant and Dr. Nicole De Paula here with us today. I am going to, first of all, invite Dr. Serge Morant to present for us. He's going to be talking about the biodiversity and climate change issues. Dr. Serge Morant is the research director of the French CNRS and CIRAD, and he's currently based at the Thailand Faculty of Veterinary Technology at Kasetsart University. He's also the invited professor of the Faculty of Tropical Medicine at Mahidol University, and his research focuses on evolutionary ecology and disease transmission and health ecology. He's concerned with the linkages between biodiversity and infectious diseases, investigating zoonoses and foodborne parasites and antimicrobial resistance at the human-animal and environmental interface. He also leads several projects on the impacts of land use change and climate changes on biodiversity and health in Southeast Asia. So, Serge, over to you. Thank you.
Thank you very much, Patrick, for this invitation. And I will share my screen. So with this, and I think it should be okay.
Perfect.
So thank you very much, Patrick. And first, I would like to thank the United Nations ESCAP and the French Embassy really for this opportunity to launch this e-learning. Actually, that the idea was before 2019, so it was before the emergence of COVID-19. Why? Because actually, is not new, and especially in the Asia Pacific, we know for several years that there is an important connection between biodiversity and biodiversity loss and the emergence and the outbreak of infectious disease. And I would say not only the emergence, but all the burden of tropical neglected disease. And I understand that is complicated for the nexus. It's complicated because you have to take into account many aspects: land use change, biodiversity change, but also social changes, and all in the economic way, climate change all together, which is not very easy to tackle. Why global changes? But because when we look at the relationship over the time, when we look at this, we have an increasing of the number of epidemics and outbreaks. During the last decade, we have more and more epidemics, and these epidemics start to be more and more pandemics. This is the same for the animal infectious disease when you use the data from the OIE. And there is a good connection between this increase of the number of outbreaks of infectious disease and the increase of the global trades and travels over the world. Another, which also was really presented before by Patrick in his presentation of the e-learning, is the great acceleration of the livestock. When we look around the world, livestock and poultry increase. It was also amazing increase for the cattle, for the pigs, for the chickens, but also with a very different distribution all over the world. But Southeast Asia and I would say Asia in general are very affected by this huge amount of production of livestock and poultry. And we know, according to some correlation studies, that this increase of the livestock, now we have to consider that the weight, the biomass of the cattle is more important than the biomass of all humans, and as well the number of chickens and the number of poultry is more important than the total number of wild birds. So all the productivity, the natural productivity is mostly for the human, but mostly for the livestock. And these are the consequences on the biodiversity loss. These are the consequences on the increase of epidemics globally and locally. But this also is increasing because at the same time, we are losing an important part of the genetic resources. All the breeds of pig, chicken, cattle are disappearing at the same time as the biodiversity, we are losing what we name the cultural biodiversity. And this is also with this great acceleration of changing ecosystem. Of course, I will use again the forest, and just this paper has appeared just today. And with my colleague Claire Lajeunie, we just have this paper published, and we were looking globally over the last 60 or 50 years, the relationship between the increase of the vector-borne disease, not only on the zoonotic disease, in relation with forest cover, deforestation, but sometimes afforestation or plantation increase like the oil palm. And what we found is clear patterns of the increase on the relationship, the clear relationship between the number of outbreaks of infectious disease or vector-borne disease, zoonotic disease with both. So there is a build on. Again, Southeast Asia is an important place. We know this already because this paper was published in 2018 by colleagues and in Cambodia, when they show what happened when there is a huge deforestation, forest loss in Cambodia, which affect directly the health of the people, the local health of the people. These affect the people. All of this, we have also the great acceleration of biodiversity loss. We have many reports, but due to the limited amount of time, I will present only the Living Planet Index, which has released just at the beginning of the year. And there's a decline, a real decline of the abundance of many species. IUCN also give the same, the red list is also increasing each year. And again, Asia Pacific is really in the red hotspot. All of this, we know that Southeast Asia or the Asia Pacific is one of the hotspots of emerging zoonotic disease. And we suspect, but we have really to work a little bit on this, that we are losing the ecosystem disease regulation because we are losing the connection between the regulation that are provided by predation, by competition, because we're also increasing the number of livestock. We favor the unregulation of the disease and the spread of the actual disease, but also of the emerging disease. The solution, so to work on ecosystem health, landscape and nature solution, this is at the local level. It has already done in Southeast Asia, for example, the urban green spaces in Asia, but also I think we can really be inspired by what's doing in Singapore, a nature-based solution and the guide, for example, guidelines for therapeutic garden, when putting biodiversity is not putting risk into the city, but is putting health and well-being for people. So we need to work also at the social ecological, what we have done now for 10 years with the local communities, local administration, taking into account this landscape and landscape change, provided also working with everybody, sharing knowledge with the stakeholders, different, including the scientists and the non-scientists, and after this, starting to imagine globally what we need, what will be the landscape that will help for a better, healthy environment. That is what we wait on, what the e-learning can really help to do this. We need to share a common knowledge, how we can develop landscape that work for biodiversity, people, and also for their health and the health of their animals and the health of the living things, wildlife. In conclusion, and I will finish with this, we have this concept, the One Health approach, which is very interesting because it's very operational. On the other side, we have the planetary health, which is also very useful because it helps us at thinking at the global level, at the governance level, related to climate change, biosphere integrity, geochemical flows. And we are in between if we work at the landscape with ecosystem services. And we can share experiences in ecosystem health, promote intersectoriality, and I was thinking of some project on promoting One Health, and PRISOD will be one opportunity to do that, to learn together, to build healthy ecosystem and environment This is the background, the basis for healthy people and communities, and healthy animals and plants. And I will thank you very much. And thanks again, the ESCAP and the French Embassy, and thanks for this, the launch of this very important and very nice e-learning for integrated action on biodiversity, ecosystem, health, and climate. Thank you.
Thank you so much, Serge. It's so wonderful to hear it from an absolute expert in this field for this region. I hope people are aware how privileged they are to have you here and to be able to call and draw on your work. Just to make a point that there is a video of Serge answering questions related to biodiversity and health in the e-learning. It's at least a 7-minute video where he talks about these different issues. And just to restate that many of the graphs and figures that he showed today are also included there. Moving on from understanding the biodiversity aspects, I would now have loved to have called on Professor Corinne Laquerie. Unfortunately, she was not able to join us today. In making up for her absence, we're about to play a video of hers that is taken from the e-learning, and where she speaks about climate change aspects and what's driving climate change, particularly in the Asia Pacific region. Let me just explain to you who Professor Corinne Laquerie is. She's a Royal Society professor at the Climate Change Science Institute at the University of East Anglia, where she conducts research on climate change and the carbon cycle, including the drivers of CO2 emissions. She's been an author on the IPCC's 3rd, 4th, and 5th assessment reports, and she was also the former director of the Tidal Center for Climate Change Research. She has investigated and led for over a decade the annual update on the global carbon budget, extremely important work within the Global Carbon Project. She chairs France's High Council on Climate and is also a member of the UK's Committee on Climate Change. Irene, can I call on you now to please play the 7-minute video of Corinne's? Thank you.
Hello, everyone. My name is Corinne Laquerie. I am a Royal Society Professor of Climate Change Science at the University of East Anglia in the UK. I'm happy to be here today to answer your questions. The first question, how does the Asia Pacific region fare in terms of global carbon emissions, and what are the key contributing factors? The Asia Pacific region is an important global contributor of CO2 emissions, those emissions that cause climate change. Very importantly, the emissions in the regions are increasing rapidly. They're increasing more than the average of the global emissions. Before the COVID-19 pandemic, the global emissions were increasing at about 1% per year of the decade before that, and the Asia Pacific region is more like 1.7%. And so we see still this rate of increase is slower than the previous decade, so we see some evolution, but to tackle climate change, the emissions need to peak and decrease and reach net zero, meaning as close to zero as possible, with a little bit of offset in the end. And in the Asia Pacific region, the emissions are going the other way around. The source of the emissions is largely in the power sector, so generating energy, electricity and heat, some of it to provide energy for households, and some of it for the industry sector. And that energy at the moment is largely based on coal, or very much so. So there is a big potential to move that towards a renewable energy as much as possible. There's also a big increase in demand for transport, and that pushes emissions from petrol consumption up very rapidly. And so there is another opportunity there. The second question was, how has the COVID-19 pandemic affected emissions levels and patterns in this region? So the COVID-19 pandemic was accompanied by measures to stop it. So the confinement measures, the constraints that were put on societies in the Asia-Pacific region has actually slowed down emissions on a day-to-day basis. We were partly able to track this. And what we have seen is that different sectors of the economy were affected differently. The power sector less than the others by about 15%. The industry, about 1/3 of the industry reduced in its activity during lockdown. And the transport sector was the one that was the most affected because of the constraint put on mobility. And that was cut by about half during the pandemic. So a country that was in full lockdown, then during that time, the emissions would have decreased approximately 30% compared to the year before that. Globally, the cut in emissions at its peak was about 17% in April. However, what we see now is that as soon as the confinement measures have lifted, and then the emissions have gone back up. And why? And that is because these confinement measures, they're not structural changes in the sense that we have the same industry, the same power, energy sources, the same cars, the same roads. And so it's not surprising that as soon as the constraint on behavior has changed, then we go back to the level of emissions that we had before. What are the key lessons and takeaway from this experience of the COVID-19 that we can draw on building back better this post-COVID pandemic? So clearly, behavior change only, so the constraints that like we had during the pandemic, although the behavior change can make a contribution, they're not the central part of responding to climate change. Responding to climate change involves an approach that is much more systematic, that has investment in the electrification of transport, in the deployment of renewable energy, in the electrification of heating, where heating is necessary, and all this at a level of ambition that is really big, but also sustained through time. There's a lot that governments can do now as the economic stimulus plan post-COVID are put in place. It's really important to see that they are coherent, compatible with the investment that you need to do to move to zero emission eventually. And there are lots of things that are compatible. There are lots of things that are good for health, for the environment, but that also create job and create stimulus of the economy. We're thinking the deployment of renewable energy is one, the investment in activities in active transport, so walking and cycling in cities where that is possible and desirable, including electrification, electric bicycles and electric mopeds, and supporting, again, heating and renovation, house renovations, to use less energy for heating in household. So along with this, there's a big role for sustainable land use. So everything that has or improves the way that we do agriculture in terms of the health of the soils, the storage of carbon in soils, and the exploitation and enhancement of forests at the same time to have a sustainable use of biomass is also quite positive. It is really a unique moment, this post-COVID period that we are living. And to be honest, the trajectory of global emissions now, and therefore the impact of climate change, it could go either way, go back and continue to increase like it was before, or start really with these measures, implementation measures, and a long-term vision, start going down so that we create a society that we can live in the long term, while really limiting as much as possible the impacts of climate change. Thank you very much.
I hope that the participants on this call recognize that there are a number of elements to this this presentation. First of all, the description of the situation with regards to kind of climate change, how we got into the situation that we're in terms of emission and what's driving it, the opportunity that COVID-19 provides in taking a moment to kind of step back and think about how we can do things better. And then Corinne provides a range of potential suggestions and options for policymakers in terms of moving forward within the space. You know, saying that it's not enough to kind of do nothing and to benefit from, you know, the impacts of COVID, you know, that have been quite positive in some climate change aspects, but to make adjustments and to kind of work forward and build forward better into the future. And, you know, she really highlights a variety of key issues and possibilities there. So that was the climate change component. Now to kind of build on our third leg, in a sense, of the issues that we've been talking about today, of this nexus issue, I would very much like to call on Dr. Nicole de Paula. She is the inaugural Klaus Tropfer Sustainability Fellow at the Institute for Advanced Sustainability Studies in Potsdam in Germany. She's also the founder of Women Leaders for Planetary Health. Prior to this, she was the executive director of a think tank hosted by Mahidol University, also in Bangkok, and at the public health facility, focused on operationalizing the One Health approach in Southeast Asia and Latin America. And her most recent research is focused on decision-making and international cooperation in the post-COVID world. She's also regarded as a pioneer in this field of planetary health. So we're very fortunate to have her here today to discuss and present on these issues with us. Over to you, Nicole. Thank you.
Thank you, Patrick, and thank you, ESCAP and the French Embassy for the invitation. It's absolutely honored to share this event with colleagues, and it's a pleasure always to be back to Bangkok, even if virtually. So let me share my screen here, and just please let me know if everything working well for you. Does it work?
All
yeah,
good.
That's yeah.
Now we're going into this presentation mode. Great. So yeah, so let's, and I was happy that Professor Serge Meron also mentioned, so I wanted to bring a little bit this idea of planetary health, and one of the dimensions that I see that we tend to forget in this nexus between health, environment, and climate. So I believe we're all here. We have this concern, right? There was this nice quote from the UN Secretary General Antonio Guterres, that humanity is really waging a war on nature, and this is suicidal. Nature always strikes back, and it is already doing so with growing force and fury. And perhaps, as we've been saying here, this climate change, the COVID-19 pandemic is really giving us an opportunity to change things. And if we see here just the numbers, right? I'm now based in Germany, from Brazil. I am from Brazil, and it's very much, of course, more than 2 million people already dead because of this virus, and so many questions of what's the connection? What is really the root cause of this pandemic? It's very easy to forget these connections to nature and our ecosystems when all we hear about is the emergency response, what we're really talking about, for example, in the discussion of vaccines. So if we're here, what it was interesting to see how COVID-19 really magnified so many of other crises that we were seeing, not only the environmental one that we're focusing today, but the social, the economic. And the question is, how can sustainable development really proactively address this interrelated challenge that we're seeing? And one of my first key messages here is that when we talk about human health in this time called Anthropocene, it's how this unprecedented change we're having in our biosphere, this geological change caused by humans, is really must be linked. So human health must be linked to this health of our environment. And interesting, this is not necessarily a revolutionary idea. And just to give an example, within the United Nations system, when you have the Stockholm Declaration and Action Plan already in 72, we have there for the first time this recognition of the right into a healthy environment. But since then, and I think we mentioned here as well, we have been ignoring these connections. And this is at a cost. This health environment nexus has been neglected a little bit for too long. And we had already data before the COVID-19 pandemic, for example, the UNEP or the World Health Organization, showing us that nearly 25% of all global deaths are related to these economic decisions affecting the environment. And the number that we also tend to hear a lot is how, especially now in Bangkok, we have the problem of air pollution very, very drastic, especially in January, when you have 7 million people, more than 7 million people dying from air pollution. But it's not only air pollution, it's also more than 3.5 million people dying from water, poor air quality. But you have other problems. We have problem of chemical exposure, for example, here costly more than $1 trillion in neurodevelopment effects, specifically in more vulnerable countries like middle and low income countries. And then there are so many interrelated crises that we don't have time to address of this, but I think it will be a very interesting thing to explore in this e-learning course that we are launching today. But the problem of microplastics, nutrient excess from farm runoff, and the problem of antimicrobial resistance, of course, zoonotic diseases that we heard today, and how all this is interconnected. So here again, just to bring the example of climate change again, being considered one of the greatest threats to public health. There are so many ways we could see how rising temperature, rising sea levels, and increasing extreme weather events. There are all this, on the side here, right, we have the problems with food supply, and we have extreme weather events that could increase injuries, fatalities, problems of mental health that we tend to forget. Of course, in the end, we could say it is a problem for global security in areas when you increase scarcity of natural resources, forced migrations. How we're going to deal with all this crisis? We needed a really connected response to these issues. For example, wildfires as well. Very much we saw this in the Amazon region, but also in Australia, even before this pandemic. So I'm a really enthusiast of this planetary health concept and notion, and perhaps a narrative for being just this broad overview of everything that we need to bring together, and we've been forgetting. So I believe it's a refined way to think about public health in this time that we are calling Anthropocene. Of course, it has strong roots in ecology, systems thinking, and also the history of the environmental movement. This concept gained a lot of force called planetary health, and since 2015, with the launch of the Rockefeller Foundation Lancet Commission on Planetary Health. So if we're going to there's a lot of discussions about definitions that I don't think we have the time to do here, but it's really the essence is to focus on this human-induced change in our Earth systems and how this impacts our human health. So it's really a preventative way. It's going beyond vaccines and beyond pills. My second message here is the planetary health is really about addressing root causes of unsustainable development. And here we have examples, of course, if you look at IPBES, how more than 1 million species are in extinction, and disconnections with the rise of zoonotic diseases that we already discussed here today. So I'll go very quickly, but I just want to say that we also estimate how this annual cost of zoonotic diseases is more than $1 trillion, far higher than this 78 or 91 billion that OECD is saying that we could use to protect our biodiversity. So we should say that nature is an antidote against pandemics. And what is a very interesting thing is in this prevention, these preventative actions, they are really cost effective. So for example, if you do more of disease monitoring, retain forest cover, reductions in interspecies transmissions, and regulation of the wild meat trade, for example, we estimate there is like between 22 and 31 billion annually. These are some papers from last year. And this is significantly less, again, not only in terms of mortality and economic cost, of course, because now we're having to pay $8 to $10 trillion to get out of this crisis. So similarly, if we have the health savings we would have from policies that reduce air pollution are also projected to be only $23 trillion. So there's a lot of strong case for this economic incentives to prevent. And of course, timing is everything. That's why despite we have the knowledge, we have the urgency, it's very clear, and yet we're still not acting in a very cohesive way. And my third and final key message here is that planetary health really requires overcoming the systemic social barriers if we want to accelerate a potential fair and green recovery. And I wanted to highlight, this is very important because we tend to forget this topic. When we talk about the recession we're living, I would like to call this she-session, because if we see that how COVID-19 has really exacerbated social stagnation, specifically impacting women, and in a very disproportionate way, not only widening this long existing gender pay gap, we have now concrete numbers, but also if you take this example that even if we consider that women represent 39% of the global workforce, they already account now for 54% of this pandemic-related job losses. And if we see, for example, who are the chronically hungry nowadays, is like 70% of women and girls. So there, and if you take this other example, only in the United States, you have 2.3 million people, women, who already dropped out of the workforce. Comparing to men, they only had 1.8 million. So this crisis cannot be forgotten here. And then what the interesting part is, just to go back to the region of Asia Pacific, it's how women and the environment are connected. Could we say that when we put more women in the driving seat of conservation projects, would this bring a positive result? And there are now some research showing that yes, even though the problem here is when you have women that tend to outnumber men as workers in many natural resource reliant, if we are doing this attack against nature, who are the first then who is going to be the most vulnerable? So here another very interesting report, even from ESCAP, that I would recommend you take a look at. That shows to us that exposure to household air pollution linked to solid fuels is the cause of 4.3 million premature deaths globally. And of course, here saying that 60% are women and children. So women remain underrepresented in all levels of environmental decision-making, and even though they face this, the largest parts of this vulnerability. I don't go into details here, but it's just to give an example with the pandemic, how much we saw in terms of the rise of domestic violence and the cost that this could bring to us, for example, the size of the Canadian economy. So there are many really strong case to bring this links of health, climate, biodiversity, but also gender equity under the same basket. And here, just to give another example, in India and Nepal, when you were empowering women in this local decision-making around the conservation of forests and fisheries, really led to a better resource efficiency and conservation. And here's this, in northwestern India, tree cover increased by 75%, where women were included in protecting forests. So again, this is just a very good illustration to see how this phrase, we're all in this together, it's not necessarily true. And I do like the planetary health narrative because it's a vision to multi-solve so many problems that we need to tackle. We don't have the luxury to tackle one crisis at a time. So we do need, so I think what we're doing today is a very good first step to improve this adaptive capacity. Hosting workshops, lectures, seminars, discourses are so important to raise awareness and really explain to us how we do this better. And there's just a quick comment that we have here for a journal, The Lancet Planetary Health. Of course, I think moving forward, it we're going to be very important to provide training or executive education for what does it mean to have a planetary health diplomacy, for example. How do we break the silos even within our international organizations nowadays? I think there's a lot of space for conversations here. And of course, finally, this breakdown systemic barriers, addressing the issue of gender, specifically through regulations, but also in terms of legislation. when you have more than 155 countries around the world that still don't have equal legislations in regards to women, that's definitely something we need to step up our game here. So I would like to close inviting you all for this global meeting, that planetary health annual meeting that's going to happen end of April, that I think these conversations can really continue out there. Thank you very much. And I hope we can be in touch and continue this conversation. Thank you.
Thank you so much, Nicole. I'm sure the participants appreciate the depth of which you've gone into here and creating the connections between health, biodiversity, and even climate change, and taking it so much further into kind of discussing gender issues too. So all these are so important. I hope that we've managed to do this justice within the course, and we've captured a lot of this information. There are a few things just quickly before we get on to the question and answer session, I would like just to quickly show people just a little bit more of the course outline. I'm just going to quickly once again share my screen. If I could just do that. Here we go. Share. Okay, so this is where I left you last time we spoke. It was around the nexus issue. So as I said, there's a lot of detail that we try to build in understanding biodiversity, understanding climate change, understanding health issues, and then exploring the linkages between these. So taking away from that is a certain amount of depth that we've tried to build in here. There are a number of other factors that I'd just quickly like to point you to. Aside from being amazing to look at and lovely to kind of read and to work through, as I'm sure you'll find. There've been a number of questions on the chat regarding certificates and assessment, and how will we know if participants have managed to pass the course? Well, just quickly, there are two aspects to understanding the knowledge and to kind of testing knowledge. The first one is we provide throughout the modules, I think there are about 18 things called knowledge checks here. And here's one example. So this question or this knowledge check at this section, the end of the section here says, does the Asia Pacific region have any biodiversity of international importance? And there are 4 different answers to choose from. And the first is, well, it's beautiful, Asia Pacific region does not have any important biodiversity. And the next one talks about Asia Pacific region being one of the richest and most diverse, with numerous endemic species and biodiversity hotspots in endemic countries. The rest, at least the next question says, at least the next option says, Asia Pacific region has some endemic species and some biodiversity hotspots and megadiverse countries. And the last one also lists something similar. So participants are expected to select the correct answer or answers if there's more than one correct answer here. And if you've read through the text above, you'll know which one it is. I could intentionally get this wrong. I won't. I'll get it right in this instance. And I click on the submit button, and it will tell me that I'm correct, and it provides the correct answer here again. If I, in fact, just to quickly give a quick demonstration, if I decided that, in fact, the Asia Pacific region didn't have any biodiversity of importance, I would submit it, and it would tell me that that is incorrect, and it would highlight where I made my mistake and provide me with the correct answer. So that's the first way we do it. The second way is by going all the way down to our fourth module, at least. If I'm scrolling down on my left-hand side here. And the entire 4th module is dedicated to assessment. As I said, it looks at a case study. We actually use the island of Borneo as the case study setting, and we ask 3 specific questions here, and we provide templates for the participants to complete. They're not onerous, they're simply some text, and thinking needs to kind of go into them, which you draw on from all the other 3 modules, and people fill those in, and it's the correct answers come up in very much the same way as has been the case here. So all the correct answers are provided as guidance within that module as well. We are also inviting people to join us on the 27th of April, where we'll be having a conversation where people can join us in a chat forum much like this and talk about their answers and questions and issues they had with the course, what was correct and what should they have filled in here and there, or what they liked and what they didn't like. So there'll be a brief conversation just to provide people with an opportunity to kind of catch up and to discuss their experiences with the course, and we can provide some feedback on different responses that they had. So that's the first thing in terms of engaging with the assessment issue. I think my colleagues have provided answers to many of the questions that have come up in the chat regarding certificates, so I won't go into that there. You can trace through those. I'm afraid I'm just going to be doing some scrolling here. It's not the easiest format to present in. You'll recognize a number of these issues have already come up in the presentations, or should I say some of these figures have come up in the presentations today. The second point I'd quickly like to make is we break the course up into must watches or recommended watches, which are videos or interviews that we've provided to you. And if we say they're a must watch, we really recommend that they contain the necessary information in order for you to proceed with the course to look at them. Recommended watching or recommended reading, as you see here, this is an interview that we've included, much like the one that we just showed you. And here's another one. This is the IPBES Regional Assessment for Asia. In this one, I think we'd say that this is a recommended reading. Some of the recommended reading and watching are slightly lengthy, so if people have got time to do those, a little bit of extra time, we encourage you to do so because it only builds depth. We've got something like about, I think it's about 15 or 20 videos and interviews that provide this additional information, as well as the course material and the depth to which this has been provided and the figures in the course. We provide an additional 15 references and reports and papers that people can download and look at and read in their leisure time, or even pass on to colleagues, because you can access those. So those are freely available on the web. The next point that I'd like to make, you can just see some of the ways this has been done, where people can walk through it. You can click on things and see how the interface works with learning, and constantly getting people to kind of think through these different issues. I just want to make the point about case studies, and in fact, I'm going to leave this module here and click on our climate change component. Here it is, 1.5, climate change. So we are, throughout the e-learning, we've tried to draw on regional specific case studies. Just continuing past that one, past that. Excuse me for the scrolling. Our case studies have been drawn from different countries and different contexts, and they cover all the different modules relating to climate change, biodiversity, and human health. Here's the one that I'm referring to. So this is a good example of where it's both a recommended reading and a specific case study that we draw on. Here we're referring to the Pacific Island countries, and this is a Rockefeller report that looks at the impacts of climate change on these specific countries. So we dig into this case study in detail. We provide the downloaded reference for it, and then we present some of the information that's found in this case study. In this example, this case study talks about different development scenarios for Pacific Island countries, where you could adopt a business as usual or a strong mitigation approach in the future, and the effects of each of these, both on the effects on the first graph shows mean temperature and how that increases, or strong mitigation and how that doesn't increase. The second one refers to precipitation. There'll be an increase in this instance of precipitation, or under strong mitigation, not so much of an increase in precipitation. And then climate change, at least sea level rise, possibly the most important, rising more than 1.5 meters under the business as usual, or simply staying below 0.5 meter, and that being the case. So we dig into the details of each of these, and throughout the course, as I said, on each of these different topics in these different modules, we try to provide case studies that people can like really latch onto and get a feel for kind of what we're meaning in terms of interpretation. So not only the case studies too, as I said, the interviews and videos. the last point I'd just like to make is that at a number of places, particularly at the start of some of these modules, we go back and we refer to the Sustainable Development Goals, and people can click on them and see how each specific, or how different specific Sustainable Development Goals and aspects of Agenda 21 relate to specific issues within this nexus, and how they also connect to one another in informing us about the nexus and allowing us to kind of monitor nexus issues, and as well as resolving nexus issues allows us to work in an integrated way towards addressing the Sustainable Development Goals and reaching these 2030 different targets. I'm going to stop there because I think it's time now to hear from you and to shift to a question and answer session. It's obviously not enough time to talk through what is in the course, but hopefully this has given you a small taste of what's to come and what you can click on. The course is an online course. It's not downloadable. You'll find the link which was sent around. In fact, if Irene would be so kind, she can put up the slide which provides the link where the course will be found, and we will of course let you know when that is available. I will now kind of ask you to please provide me with any questions you might have, and we can get into a question and answer session. Okay. All right, to my chat screen. Okay. If anybody has questions, I could ask Irene to unmute you, and you could please speak. Okay. I'm not seeing any questions yet coming through in the chat. As I said, the ones regarding the certification of this e-learning will be provided, where we will send you a certificate if you request one, and this will be based on attendance and completion of these different modules. If any of my fellow panelists have got any questions that they would like to ask, Nicole, please go ahead.
I'm curious. First, I want to congratulate ESCAP and of course the French EMS for this. It's an amazing resource, and it's so important in this time. We're all going so virtual, and I think this is the perfect opportunity to use out of this tragedy. There are many good things coming out of this in terms of knowledge and sharing. So congratulations again. How long do you think it would take for someone then to take this course in terms of an estimation of time? How much
thanks, Nicole.
They would have to put?
Yeah, so when we set out to design the course, we set each module to approximately take about an hour and a half each. So that's a 6-hour completion time. I think we made the final module. You have to fill in 3 different templates, and depending on how much depth you go into the case study, it might take an hour to an hour and a half. So at best, I'd say that it will take 6 hours. It's so tempting to include more and more literature and more figures. As one of the people working on designing the course, it was very easy to kind of get carried away with the material, and to really, I found myself really enjoying what I was reading, and I wanted everyone else to see it and share it. And so, we probably put too much in, but people can choose to engage with the recommended material or simply set it aside and leave it for another time. So about a day, I would say, to complete the entire course. Yeah, thanks.
Wonderful, thank you. Can't wait to see it.
Yeah, it's nice to see it all coming together and being completed. Yeah, okay. I see that the link has been provided. You can see in the chat there is the link which will be made available for the e-learning course. So if people want to either save the chat or save the link, that is where you will be locating the course. As one of my colleagues has noted earlier in the chat, this course will be available within the next 2 weeks. If I click on it, you will honestly think that it is complete. It is virtually complete. There are a few typos that we want to make sure of, and a few other things that we are just checking, but on the whole, it's virtually there. Okay. So there's a question that has come in on the chat here, and they'd like to ask the panelists, what are the main barriers to adopting Nexus approaches in Asia and the Pacific, in their opinion? I'm going to call on, again, Nicole and Serge to respond to this question regarding what do they think are the main barriers for adopting Nexus approaches or dealing with Nexus issues in this Asia-Pacific region. Okay, who would like to go first?
I think Serge can go
Nicole.
first.
Okay, please. Thank you.
Okay.
Go ahead, Serge.
It's quite difficult. I understand very well, and especially when you work really on the ground and you work with the local administration. Why? Because first, on these every countries, and not only in Asia, but it's the same in Europe, in France. There is a problem really, and it was also already said, of silos. So between different administration, they have their views, they have their knowledge, but they don't know how to connect. So how to make a nexus actually around health issue, biodiversity issue, and facing the climate change. They all know that they have to face this. They all know, no problem. So, and I completely agree with you with what Nicole said about this learning also by the scenario thinking. And I was working with the province in France, the Région Nouvelle-Aquitaine, the New Aquitaine, and they asked me, by the Department of Environment actually, to organize with them a way how to implement the One Health into the province, knowing that they wanted by the environment, which was very good. And I think it's a good way to do that, because if the environment takes this as a really important concern and say that, okay, our target is healthy people, because we work on the healthy environment and these healthy animals. And with this, you can go on with the livestock sectors, with the health sectors, and of course with all the other one, development, security, whatever. But that's why we have to tackle by the environment and by the intersectorality.
Yes, can I just complement that? And I think it's for sure is the word is really silos, right, Serge? We know that this fragmentation, it happens not only in Asia Pacific, but everywhere. And I just want to give a very short example because it's so concrete. I'm now in Germany. And one of the things we're seeing, what's the barriers also, we need to change also in the field of medicine, the future doctors, what's the importance then of ecology and all the other, should doctors learn about climate change? How is it impacting? So there is a greater move now to include this type of knowledge in the curriculum of even in medicine. So it goes both ways. Everybody needs to, I think it's also breaking mental silos. We need to learn different things and from different, of course, actors as well. And I think Serge has a lot of expertise, and I could witness also in Thailand when you go in working with communities, it's also their knowledge needs to inform the work of researchers. And that's also, it takes a while that we could pass this message. And I think with the COVID-19, and that's why we call it a window of opportunity, because these questions are now so pressing because everybody's suffering from the silos. So it's a good opportunity.
Yes, thank you so much for those answers. I agree. I think the course really tries to hit home the fact that this integrated approach is so important on so many levels. Just to kind of take it up one step further, it's not just the silos within countries, but also across countries and regional collaboration, that we also try to make that point that this is vitally important as well in solving some of these issues. There's another question. Nicole, this is definitely for you. What do you think is the role of women leaders, and how can they help promote planetary health?
Thank you for this question. I think it's absolutely essential now that we see how disproportionately affected women were and other vulnerable groups as well during the COVID-19. And just to give a very concrete example, again, if we do a survey of more than 1,000 papers in ecology, conservation, that are, science that are very important for planetary health, we see of course, a very big disparity. The global north, it's 86% of top publishers, but of these top publishers, we have, and English speaking also, and then we have 11% are women. So it's just how much we see, we need to have this, whatever other groups as well. When we break the social barriers, we need to have their voices heard, because how can we provide solutions when you don't take perspectives of people who are suffering from whatever problem we're trying to address? Could be environmental, could be health. This is just a general problem that we face. So we believe that once we have these women also driving the process and designing solutions and really co-creating these processes, we have better chances to have the right and effective solutions, because there's a lot of replication of things that don't work and ignoring the point of view of those who are being affected. So I think women have a lot to contribute at the moment.
Thank you very much. Please do get your questions in if there are any others before we close. Also, just to make the point, a number of messages in the chat have talked about wanting to use this material for lectures and to access it in different ways. We have, throughout the course, tried to provide all the references that we use for the figures that we've done. So it will be very simple for people to, if they like a particular section or if they like a figure, to trace it back to its original source and to use it as appropriate. You know, obviously contacting the authors of that first of all, but you know, everything should be highly traceable, and I'm fairly confident that aspects can be drawn on, and hopefully it can, you know, whatever helps to spread this message, I think is important and it will be appreciated. Any other questions there? No, nothing further. I suspect we might need to shift to the closing then, if there are no further questions from anyone. That being the case, I would like to ask Dr. Katinka Weinberger, who is the Chief of the Environment and Development Division of ESCAP, if she wouldn't have the final say and close us off. Thank you very much, Katinka.
Thank you very much. Can I just check whether you can hear me?
Yes,
All
we
clear.
can hear you. Thank you.
Okay, great. So firstly, thank you all for attending this side event. It's really great to see that after a very long day with many roundtables during the APFSD, still there is so much interest in this topic. Thank you also, Patrick, for your introduction and for moderating this session this afternoon, and for all of your work on the course. And of course, also to the French Embassy here in Thailand for their support and for their collaboration in putting this together. And finally, thank you also to the panelists this afternoon. I think as the first day of the APFSD yesterday, and also the discussions during the roundtables that we had today, brought out very clearly, the COVID-19 crisis continues to test every country in our region. And it's a health crisis and a socioeconomic crisis that is happening in the midst of an ongoing biodiversity and climate crisis. And as we prepare for recovery, which we would like to be sustainable and resilient, the Secretary General of the UN has been very clear that the SDGs need to play a force for good in transforming our societies in the post-COVID-19 era. So for that, we need policy packages that create harmony between health and economy, and between economy and the environment. That's a role that we play here at ESCAP. We promote integrated environmental policies, but we also work on regional collaboration across Asia and the Pacific. And over the past year, a lot of work in our division has been focusing on assessing whether stimulus packages are green, to ensure that the recovery from the COVID-19 pandemic can be as green as possible, and to support our countries in ensuring that Asia Pacific does not slow down or stop or reverse its progress on the SDGs. and in promoting approaches such as planetary health that can tackle environmental and health issues together in the long term, as we just heard from our panelists. So to this end, we have been developing knowledge products, we have been organizing trainings, and we've hosted intergovernmental meetings. And we are also discussing this on sustainable and resilient recovery from the COVID-19 pandemic in Asia and the Pacific. Also, we're looking forward to the 77th session of the ESCAP Commission, which will be held in late April on building back better from crisis through regional cooperation in Asia and the Pacific, where we will also be focusing on a discussion on environment and human health. So I would like you to recognize the work that has gone into the training, very much presented in this context. It is informed by our ongoing research, as well as the feedback that we are getting through the regional dialogues that we at ESCAP are engaged in. And we recognize the need for such a nexus training and developed the module with the expectation that it can support governments in Asia and the Pacific and other stakeholders to adopt such integrated policies. So we will make it available shortly, within the next 2 weeks. We will be sending all participants of today a link. And I think as has also come out through the intervention of a moderator early today, you will have the opportunity to provide us with feedback on the module, because you will be the first batch of learners. And we all here at ESCAP, and together with the team that has contributed to the learning, hope that this work will support all of you in developing and in adopting effective policies that address the nexus between biodiversity and ecosystems, health and climate change, to ultimately mitigate and better manage the impacts of future zoonoses, to protect our planet and human society. So with this, again, let me thank all of you for being here today with us this afternoon. And can I please ask Irene to pull up the slide which shows the link to register again. Thank you all very much.
Thank you all. The link that has been posted into the chat is the exact same one that you see on the slide right now. So we're going to give you a few seconds to save that link to make sure that you have access to it, and we will close the Zoom meeting shortly. Thank you all very much, and have a great rest of your evening. The Zoom meeting will end now.